we got another warrior of the week. The goal here is to help you understand what is possible for you by doing the program. The goal is also to let the world know that they can get better. Many people struggle and feel like they're not ever going to get better, and they can get better. So that is the mission, is to make sure everybody knows that they can get better. As we teach you what is possible and you understand better and more about what is possible, you do the work. That's the key. So the rising tide lifts all boats. So as one of us gets better, we all get better. And the key is to share the information. So this is a 40-year-old male who had a herniated disc. Now, 2 years ago, he was very, very, very active, very fit. Zena. And he was playing a lot of sports, and he bent over to pick up something heavy. And this is the key right here. And he herniated the disc. And he herniated his disc. He had severe pain in his low back and severe pain down his leg. Here's the herniation right here. It's a big one. A couple weeks in a row now, we've seen a big one. So that's another big one right there. And he was getting the pain in his leg. And we're just going to do a quick review on this because this has come up more than once. What exactly happens? So you've got 24 vertebrae between the head and the hips. The vertebrae are the bones. And in between each bone, there is a disc. The disc allows enough space for a nerve to exit off of the spinal cord through an opening here called the foramen. It's in that area typically where the nerve gets pinched. Right here. And it's pinched very often by the disc. So he's having the pain in his back. Well, he had bent forward, and very often when you bend forward and you pick up heavy objects, what it does is it forces the nucleus out, and as it forces the nucleus out, it aggravates the annulus, which is very, very, very painful. But also, as it pushes out like that, it'll start to pinch the nerve that goes down the leg. So this is the herniation here, and his is right there. Getting the pain that goes down the leg from the herniated disc, pinching the opening where the nerve comes out. Now, he did nothing, rested, and the pain went away. And then, shortly thereafter, he was doing some exercises, because he's a very fit young man. He was doing exercises that was flexion. Now, one of the keys when you aggravate the disc is the mechanism of injury very often dictates your bias. So he was flexing, hurt his back. So in his case, he was an extension bias. Now, 80% of the time, the injury is the mechanism that creates your bias. So in his case, he was an extension bias. He bent forward, hurt his back. Now, 6 weeks later, or sometime later, February of 2020, he re-injured his back, and he kind of thought it was going to get better, but the way he re-injured his back was doing a flexion exercise. He's extension bias, had a delicate disc at the time. Doing more flexion exercises makes it worse. This is important. So he thought it would get better. 6 weeks later, no better. Went to see a surgeon. Surgeon recommended a microdiscectomy. And at the time, he had to wait to get the surgery. So he was waiting to get the surgery. And at the time, he was also seeing a physical therapist. Now, the physical therapist he saw gave him a flexion exercise. Meaning that he was doing all the things that were making it worse. In an effort to try to make it better. So he thought it was going to get better, and he was making it worse. An expert tells you what to do, and you do it, and it makes you worse. Now, he was waiting to get the surgery. Physical therapy wasn't working. They were giving him the wrong exercises. Now, here's the key. It's not uncommon that you do things that maybe aggravate you because it's going against your bias, meaning you're an extension bias, you're doing flexion exercises, real common, or no exercises for that matter, and then you wind up getting surgery, but nothing's ever done to restore the function, which is what was happening. So he started our program and started getting better. And this is a copy of his bias sheets, and probably you can't see this because they're small, but he was blatantly, when he bent forward it was a 10, but when he laid on his stomach or bent back it was a 1. So he was definitely a extension bias patient. Went through the program and the numbers progressively went down to 0, but he started the program. He understood that bending was a problem. He understood that the core was an issue. Had to work the core and the shoulders. Increased his strength over time. Eventually, as we increase the strength, the pain goes away. Because we're avoiding the activities that make it worse, and we're stabilizing and strengthening all the components to make sure the spine does what it needs to do. His pain went down to a 0. To this day, his pain is a 0. He does 1 hour of exercise every day where he works his core, his shoulders, and his glutes, which is the hips. That's what you have to work. And then he walks 3 times a day. And his goal is to make sure it never comes back. Got to stabilize the spine. Core, glutes, shoulders. Now, very fit, active guy. He rides his bike, he runs, he skis, cross-country skis, he swims, and he plays with his kids. And his statement was, I'm enjoying every day. The second time he had a flare-up, it wasn't going away. He was very concerned. As we all get concerned when our back pain doesn't go away. Went away. He's doing the work. He's doing the right thing. He identified what he had to do, and he did it. That's what warriors do. We do what we have to do. We know what we have to do. We do the work. That's the key. The discs will get better. Stick with the program. You'll get better. You do the right thing, you'll get better. We've seen herniated discs on MRIs get better. Avoiding the activities that makes it worse will allow everything to get better. We call this program the 10X program. If you have back pain and you're not getting better, you can get better. That's the key. Took 30 years to develop. It's the most comprehensive scientific program available. Every week you get new exercises. You identify what you have to do, and then you do it. This program's $47. If you sign up, it's $47. You have access to me. You can ask questions. We have a member group you can be part of. You can get better. Get your life back. Live your life.